So this is a talk about Chapter 25, Violence and Human Abuse, and this is our last discussion about vulnerable populations in this for this week of Friday before spring break. So we're going to discuss the problem of violence in American communities, describe factors that encourage violence, define 4 general types of child abuse, and analyze the role of the nurse working with survivors of violence. So violence is non-accidental acts that result in physical or psychological damage to one or more of the people involved, meaning could be a mother to the children, a father to the mother and the children. It's non-accidental. And nurses may care for the victim, the perpetrator, and witnesses to the abuse. And so we have to, again, be aware of our feelings, be aware of our emotions related to this, and be aware of our standard and of practice that will be provided to the person who's in front of us, who may be a perpetrator. If there's a shooting or a stabbing or something like that. And nurses can use policy to respond to violence. We're going to talk about that a little bit later. So there's some community factors that contribute to domestic violence and violence in families. Employment, when people are working but the job creates a lot of frustration and resentment, that can contribute to violent behavior, aggression, because it's unfulfilling work and is contributing to stress. And workers may have stress and job problems but bring it home. They don't know how to separate those feelings, and they bring it home and punish the people who are at home. And they're stuck in their jobs. They can't get out of the job because they need to support their family. But at the same time, it's creating this violence and aggression. So we're not in a time of economic downturn. We're not talking about economic downturn at this time. However, we have to be aware that just because people are working does not mean that it's fulfilling work, or does not mean that it's a living wage enough to support the family. And so again, frustration can build. In our education system, there could be a lack of parental discipline. There could be permissiveness at home, or lack of regard for child following rules. And so then the child comes to the school, and the school needs to be put the hammer down and be the disciplinarian. Parents may be spanking children at home. There may be bullying at school that leads to violence. And is a form of violence. There's bullying at work. Again, we talk about violence, lateral violence between nurses. And schools can turn things around and can contribute to nonviolence by working with bullies and giving kind discipline. The community structure can influence violence. When you're living in crowded conditions, there's a potential for tension and violence. We see that with, snow events, and somebody plowed themselves out and somebody took their parking spot, and now it's very tense and very angry. Gang violence can be in a community. People are afraid. People are limited in where they can go. But the gang becomes a type of society for them, as a belonging for them, but it raises the violence in the community. So know these terms: the term homicide, assault, sexual violence, rape, and suicide. We can have sexual abuse. I'm sorry, I'm looking for something. Physical abuse in families. We can have economic abuse. We can have destruction of property that's violent. We can have threats. We can have stalking. And emotional abuse. So it's not just the physical abuse that can affect people in a family. Remember the term neglect? We talked about this with elders. It's a failure to act as an ordinary prudent person, failure of a caregiver to provide services necessary for physical and mental health of an individual. So children can be neglected, elders can be neglected. We saw that family that had, I think, 14 children, and they were never allowed out of the home. They did go to Las Vegas once, but the physical conditions of the home were filthy, unsanitary, and it was just a type of severe neglect and abuse. Intimate partner violence is a term in the last maybe 5 to 10 years that is violence between partners, and we've talked about abuse of older adults as well. We are mandatory reporters for child abuse. So the public health nurse will screen potential victims of family abuse. We see clients in a variety of settings, so school nurses can screen for potential, occupational health nurses can screen for potential victims of violence, clinic nurses, and hospital nurses as well. And then, excuse me, provide information on safety and shelter. If they're not ready to take it then, they can keep it and use it later. When I heard a talk by Laurel House, which is a women's shelter, she used to give out lipstick cases, and within the lipstick case was the paper rolled up that gave the information on when you're ready to leave. Call this number, we will pick you up, things like that. This was a time when there weren't cell phones, but I think it's still effective because you can't have a big pink paper that says how to run away from your abuser, because if the abuser sees that, it then becomes a very dangerous situation for the woman. But when you have it rolled up in a lipstick case, most people won't go into somebody's purse and take out their lipstick and open the lipstick and look at that. So it was really, I thought, a really clever way to hide the information, because she could throw it in a makeup drawer, throw it in her purse, and have it for when she needs it. We want to provide interventions for each level of prevention. So we want to prevent the violence, if we can, building self-esteem, and educating on, the signs before they happen, so that they can, if it does happen, they would be aware. Because a lot of people fall into a trap that they don't even really understand what the situation is, and they continue to be abuse. They continue in the abusive situation for years. We want to refer them to community services, but we realize that they may not be ready at the time that we are referring them. The mandatory reporting gives nurses immunity from liability of so that nobody can say, well, I was afraid I was going to ruin the reputation and get sued for ruining someone's reputation. If you suspect abuse, you are to report it to the correct channels. I think it's Department of, I'm sorry, I forgot, but in Philadelphia, I think it's DYFS, Department of Youth Services, where they will then investigate. So if you suspect it, or if the child has told you something, then you report it, and then that agency will take over. It is a requirement of our licensure. When you become licensed, or maybe before you become licensed, you will have to do continuing education hours, CEUs, of mandatory reporting of what nurses are required to do. Secondary prevention of domestic violence is universal screening, and I'm going to put up a PowerPoint that you can just scroll through, put up by AWON, the Association for Women's Health Nurses and Neonatal Nurses, Women's Health Obstetrics and neonatal nurses. A1 really has a lot of good points about working with women, especially pregnant women, become very vulnerable to domestic violence while they're pregnant and afterwards. The goal of universal screening is that the person would be able to find, the respect, the self-respect to get out of the situation, that we could then move towards healthy relationships, move towards living free, growing and thriving. And that comes from the A1 PowerPoint. But we don't want people to live within these situations, and so we're screening in order to get them out of the situations of domestic violence. They do mention that the women are not embarrassed by you asking about it, but that universal screening should be done at the beginning of pregnancy, throughout pregnancy, and at the end of pregnancy and postpartum, because pregnant women are vulnerable at all of those points. These are the questions you would ask. Have you ever been emotionally or physically abused by your partner or someone important? Sorry, I didn't take out the extra words. Someone important to you. Within the last year, have you been hit, slapped, kicked, or otherwise physically hurt by someone? Since you've been pregnant, have you been hit, slapped, kicked, or otherwise physically hurt by someone? Has anyone forced you into sexual activities? Are you afraid of your partner or anyone that you mentioned during our talk? So they're simple questions to ask. We have child protective services, child abuse prevention programs, domestic violence shelters such as Laurel House, which are hidden within the community. We have a program for children of battered women because they see the effects. Even if the children are not physically hit, they are psychologically abused when they see their mother hurt. They have hotlines and crisis intervention and counseling available. The Women's Law Project will help women through difficult situations, and then Women Against Rape, the war again with sexual abuse, sexual assault programs. That's the end of our talk. There's a lot of terms. I hope you will see the extra information on the internet, and I will be able to answer any questions when we return. And I'll post some quiz questions after spring break. Have a wonderful break. Thank you.